think our continent need really to be able to have their own independent governance system. Talking about medicine is a key. I was very proud that we reached first also our goal. We were thinking it would take us 1 year or more, but in less than 5 months, I think we have been able, even 3 months, we managed to have 15 ratification. So in 2 weeks, 3 weeks from now, we can really have this treaty going into force. So, but also what I want to add to that is more than 50%, almost 50% of African countries signed the treaty. Yesterday, Uganda also joined and signed. So I think it's important for us to say that a global commitment around this critical agenda. I saw it from private sector. I saw it from civil society movement, patient groups, all the constituencies which are needed to make it real.
Thank you for joining us on the HSS Podcast with me, Lenias Hwenda, where we talk to leaders and change makers who are transforming healthcare in Africa. This is the Titans of Industry podcast series, in which we're talking to the leaders who are shaping the African pharmaceutical and vaccine manufacturing industry about their work, the challenges and the opportunities of making medicines and vaccines, as well as other medical products on the African continent. As today on the HSS Podcast, I am in conversation with the Honorable Minister Michel Sidibe, who is the African Union Special Envoy to the African Medicines Agency, the former Minister of Health in Mali, and the former Executive Director of UNAIDS. We are discussing the progress that Michel and his team have been making towards bringing the African Medicines Agency to life. Good morning, Honorable Minister. Welcome to the HSS
Good morning. Podcast. I'm so pleased to be with you today.
Wonderful. Honorable Minister, I know you have been very busy. Can you just begin by telling us what you have been doing at the African Medicines Agency? What has been happening in the past year, and what progress have you been making so far?
No, let me start by saying that thanks to African Union, thanks to the heads of states, and thanks to President Faki, and the commissioner, because giving me the opportunity to be a high-level advocate for the creation of the African Medicine Agency was for me one of the best appointments I could have, because I'm convinced that we need to change completely the face of governance system of our continent when we talk about medicine, when we talk about vaccine. And we have been experiencing that with COVID. But now to come to your question, I think we were impressed by the commitment of the different government and head of states and regulatory bodies which we have been visiting. I visited in less than 3 months, 18 countries, meeting almost 16 presidents, foreign ministers, minister of health, head of regulatory bodies. And we managed to demonstrate that the sense of urgency can be there. And also we can quicken pace of action. So today we have already achieved the goal of having 15 countries ratifying this treaty, very important treaty. But also we had already 17 countries who ratified and deposit the instrument. So in 2 weeks, 3 weeks from now, we can really have this treaty going into force. So, but also what I want to add to that is more than 50%, almost 50% of African countries signed the treaty. Yesterday, Uganda also joined and signed. So I think it's important for us to say that a global commitment around this critical agenda. I saw it from private sector. I saw it from civil society movement, patient groups, all the constituencies which are needed to make it real.
Wow, wonderful. It sounds like you have actually made very rapid progress. There were concerns by some in the African manufacturing industry that countries' governments wouldn't move fast enough to get this treaty ratified so that we could see AMR coming to life. But it seems that there has been a lot of commitment out there, and you have exceeded your own expectations of the timelines that you expected to have this ratified. So now that you have enough countries to ratify AMR, what should people in general and people in the industry who are involved in making medicines and vaccines and medical products expect to happen next? What happens now from where you are?
No, I think what is very important is to also say that it was long due. I personally feel that people were not just crying for crying. With 17% of what I can call really the world's population, in Africa, 55 countries with 1.3 billion people. We have to remember that we still have 25% of the disease burden in our continent. And we have to remember that 60% of the people living with HIV and more than 90% of the people almost dying from malaria or coming from our continent. So I can say that it is timely to have a strong regulatory body. Without this regulatory body, you will never be able to have a well-functioning health ecosystem. And now that's why I said, after this ratification, it's very important that we move from the political process to operational process, which will mean knowing where the AMR will be hosted, by which country, knowing how will be the proper vision, what we want really AMR to do, how we will make sure that it will not duplicate the existing regulatory bodies, how it will be able to tap on a free trade agreement to help to move drugs from different places, but also working very closely with the CDC Africa. So I think next stage now is about that, is to operationalize the vision, to make sure that we can be able to really demonstrate that this instrument will be an African medicine agency. I insist on that because we need a more resilient response, and we need to be more independent, to say we need to be less dependent to decision taken from abroad when we talk about the health of our people.
Absolutely. It's necessary and long overdue, and it's great. So the next step, moving from the political process to the operation, to the operations, putting it into effect and working towards opening the doors so that AMR can begin its work. So do you already have a director general who is going to lead the agency? Who appoints them, and have they already been appointed?
No, I think that is very early. Like I said, we are a very early stage, and what is the most important today is first that the treaty could enter in force, and when the treaty enter in force, it's very important that the signatories countries could be around the table and start defining what they want exactly from AMR, and also probably having a transparent process for making sure that country who will host AMA will be selected and the decision taken by assembly. So I think you have still a process there. I think, and then of course, the recruitment and other staffing and other will come later on. But people need to just understand that we have also some regulatory bodies with some capacities in the continent, but unfortunately is very fragmented, and we have not been able to mutualize all the competencies which are in a different part of this continent. So that is also important. It could be in pharmacovigilance, it could be in bioequivalence, it could be in even, ethical issues. It could be how to fight against fake medicines. We have major issues, but we can also start with supporting the production, local production. We are seeing already, excellence, hub of excellence for vaccine, which we are producing only 3% of the medicine we are consuming. So we have things to do here.
Yes, absolutely. Quite a lot of work to get everything aligned and have all the structures in place so that you can actually, decide how it's going to be run and so forth. So that does that mean the governance and all of those structures are still to be decided when member states are meeting?
Oh yes, I think we cannot just go without making sure that we have a member state deciding and taking a right direction for what they want, because it is a continental body. It is not a private body. It's something which will operate to really strengthen the capacity of the continent in the global debate concerning the health of our people. That is so key. So you cannot just decide quickly and think that you will put in place. So that process is coming. I am convinced it will be taken very seriously by member states. I am 100, because AMA is so close to their heart. They saw it.
Yes, that is certainly reassuring to hear that, heads of states really consider this a top priority. And indeed it is, because we don't know when the next crisis is coming around the corner. So it's great that there is a sense of agency in moving this forward and doing what needs to be done to get it up and running. If you support our work, please do subscribe, like, and share our podcast. We'd also love to hear from you. So do please send in your comments and your feedback on some of the things that you'd like to hear us discuss on this podcast. Thank you for watching.